I know a lot of you would like to get in shape for the summer, maybe get out and take a nice walk, but you're in pain. Your back is really, really bothering you, and you're not alone. It's such a common thing these days. We can get you better, though. I think Dr. Nicholas LaHood from San Diego Spine and Disc Laser Pain Center would certainly like to try, and at no obligation or cost to you whatsoever. So there's going to be an offer on your screen. You can go ahead and start calling anytime this makes sense to you. How many folks in general, I mean, what's the percentage of folks that will eventually have some kind of a back problem?
There's a lot, Mark. There's so many people out there that have severe back pain that wake up every single morning with a sharp or dull chronic ache in their back. And I'm talking about back pain that's been there for months to years at a time.
But eventually, the statistic is just huge. It's like 80% of people or something will experience some kind of back problem.
It's very common. You know, 80% of people will have back pain at some time in their life. And 85% of those people, we find that the underlying cause is a degenerative or herniated condition of the disc in their back. So if you have been getting pain management injections into your spine, if you are taking pain medication every day, you may be a great candidate for this non-surgical program that we have.
So let's talk about this program. It's totally non-surgical, it's non-invasive, but what you're trying to avoid is what we're looking at here, the x-rays of somebody who's had back surgery and had the pins and screws and rods and all this stuff put into their back. These surgeries fail at an alarmingly high rate, unfortunately.
It really restricts any further movement of the joint above and below that surgical area if the joint is fused. And your spine is designed to absorb fluid into it. The disc is filled with fluid. So if you restrict movement with pins and screws and bolts, you know, the other discs around that area are going to have a hard time getting the nutrients that they need to stay healthy. So, you know, really, if you're looking at different alternatives, if you're looking at back surgery, if you have chronic back pain, we've got a remarkable non-surgical decompression combined with a laser treatment that gets such a high effective rate on reducing pain.
So folks, the offer, again, I told you it was going to be on the screen and it's up there. For the first 25 callers, you'll get 2 free decompression treatments. Free, no obligation whatsoever. A consultation with the doctor and an exam, and 2 free laser treatments. And the decompression combined with the laser, it helps rehydrate the disc and it helps heal the torn tissue around it. But this graphic, this is the best I've ever seen. It shows how when you take the pressure off, that disc retracts back into place, and it takes the pressure off that bright red nerve that's inflamed, takes the pressure right off of it, and reduces the pain. And it's pretty easy to understand how decompression works. The thing that people don't understand is how do you keep, once people stand up and walk out of the office, how do you keep that disc from recompressing and bulging back out again?
And it's all about the technology and the system and the protocol and how we have it set up. These deep tissue class 4 lasers are really remarkable on what they do to the ligaments around that water in the disc. So after a comfortable decompression treatment, you know, that relieves the stress off the joint. So again, you know, if there's a positive MRI that says disc bulge or disc injury or disc degeneration, this unit can help rehydrate and stop that diagnosis from advancing. The laser treatment seals up these cracks and fissures and tears that occur in the outer part of the disc to stabilize the patient long term.
So, and a lot of folks, they walk away from this treatment already feeling better just after the 2 free treatments. And again, for the first 25 callers, 2 free decompression treatments, 2 free laser treatments. Again, totally non-invasive. Now, you'd love to catch people before they've had the surgery. You can still help people who've had back surgery, but you'd really like to catch people before they've actually, especially if they're in the process of deciding whether or not they might need surgery.
Right. That, you know, as that disc deteriorates over time, it gets smaller and there's more calcium buildup around the joint, causing stenosis, which is a more severe diagnosis. So really, the earlier that you catch this problem, the better off the patient would be.
So if you're just experiencing back pain that's uncomfortable, it doesn't have to be horrible. They'd love to get you sooner rather than later. So there's the offer on the screen again. For the first 25 callers, a free exam, 2 free, totally no obligation laser treatments and spinal decompression treatments. And they'll have a great idea, and so will you at the end of those 2 free treatments, whether or not you'll respond to this before you've ever spent a dime. So, Doctor, thank you.
Thank you, Mark.
It's always good to see you. All right, for more information, you go to san-diego6.com, you click on San Diego Living, but it's the San Diego Spine and Disc Laser Pain Center.